imbalances and chakras replenishment in prevention and treatment of cancer. And analyzing the studies we have in the literature, they aim to give a supportive treatment to this kind of patients using these kind of, I said using Chinese treatment, but this kind of patients who are undergoing cancer treatment using chemotherapy and or radiotherapy. All of them aim to control only nausea, vomiting, depression, and loss of appetite, etc. But this presentation I will give you today is different from what we have in the literature, for I will approach the pathology of cancer from the energy point of view, not to treating only the symptoms as the cancer itself, but the patient as a whole, observing the influence of the energy imbalances on the cancer development. And for you to understand a little better the way of thinking proposed on this study and the other studies of mine, I'd like to start this describing the case that originated the theory that guides the proposition of the diagnosis and treatment. In this case, I treated myself in 2006. Let's start. And this patient in question had the leg pain in both legs when the first reached to me, for the pain would not go away with the use of anti-inflammatory medications. And the patient also informed to feel cold in the lower limbs. According to traditional Chinese medicine, the patient was diagnosed with kidney yang deficiency. And first, I performed the physical examination and questionnaire to diagnose his energy imbalances, and the treatment consisted with Chinese dietary counseling, auricular acupuncture, and systemic acupuncture. And he did also the apex bloodletting, is a procedure I usually use to take out the heat retention. And with this treatment, he was normally treated with the described procedure and recovered from the pain in the legs after 10 sessions of the acupuncture. After 30 days, he returned to me to be reevaluated, and he also said that he improved one condition that I was not aware, that was his glaucoma condition, that for the last 40 years of his life, he was treating for glaucoma with no improvement with the eye drops. And this was the first time that his intraocular pressure reached from 40 to 17. And it normalized his eye pressure, but I was not aware he was having high intraocular pressure. And I was much impressed with this result, and I sought to study as a researcher at the Brazil Medical College in São Paulo University in the ophthalmology department on the glaucoma session, exploring and demonstrating the effect of acupuncture in glaucoma patients. And based on these observations, this study was presented for the first time in 2007 at the American Congress of Acupuncture in Baltimore, United States. And also in 2015, it was represented again with another title, Acupuncture Viewed Holistically Can Treat All Symptoms and Disease, at the same time at the Acupuncture Research Conference at Harvard Medical School. In this presentation, I emphasize the need to treat the patient holistically, treating these energy imbalances between yin and yang blood that are the all treatments that I do in all my patients of all diagnoses, aims to have this balanced state between these four energies. And to better explain my reasoning, I always like to use this metaphor of the tree. I use the metaphor to make a comparison of Western medicine from ancient medicine, such as traditional Chinese medicine. On this slide, you can see that the tree has a root, trunk, and several branches, and coming out of each branch, many leaves. In this representation, each medical specialty is represented by a branch, and the leaves of each branch represents the symptoms and disease related to each specialty. And I would like to show you that Western medicine treats the leaf level because they are focusing cancer itself. But in my presentation today, I will show you what are the energy imbalances that are in the root level of the tree that are usually not seen by the naked eye because they are below the earth here. And considering the influence of the external pathogenic factor that the Western medicine does not address usually. And now I will begin to describe, I will describe in this 33 case report of patients with cancer. And I will show you how I did my reasoning in the treatments. And in November 2018, this patient, 70 years old, did a routine gynecological exam, and the doctor requested a thyroid exam. On the result, it was found that the patient had 3 malignant tumors on the thyroid. The biggest was 14 centimeters, and the patient was submitted to a biopsy, which confirmed the diagnosis of malignancy. She was then taken to another specialist on disease of head and neck, which requested an urgent surgery to take off all the thyroid and do iodotherapy and chemotherapy afterwards. And she started treatment with levothyroxine, and stressed out by her recent diagnosis, the patient sought my clinic again after a long time. I had previously done acupuncture treatment on her. She also had diabetes, hypertension, and diabetic retinopathy. And once she came back, I diagnosed her according to TCM with deficiency and heat retention. And I did the Chinese dietary counseling, avoiding dairy products, raw food, cold water, and sweets, and also to avoid the fried food, chocolate, egg, honey, coconut, and alcoholic beverages, and also soda, coffee, and matcha tea, because all these diets could imbalance the energy meridians. I also did a weekly acupuncture with apex bloodletting, and I did the chakras energy measurement through the radiesthesia procedure to measure her chakras energy, and each chakra here corresponds to one massive organ in traditional Chinese medicine. The first corresponds to the wood and liver. The second corresponds to the water element and kidney in TCM. The third corresponds to the fire element and heart in TCM. The fourth is the metal element and represents the lung. And the fifth is the earth element, corresponds to the spleen. All her chakra were in the lowest level of energy. And each chakra is responsible for that energy. That yin and yang is formed by the kidney, the blood is formed by the spleen, and it is controlled by the heart to control the blood inside the vessels. And the qi is produced by the liver, and lung is controlled by these two organs. The distribution of qi is made by the lung and the liver in the energy point of view. And when we have yin and yang and blood in adequately amount, qi automatically will be good, in a good state. And here is to show you that I use the high diluted medication and the crystal-based medication to treat this lack of energy. Here's one publication I wrote, is a research article that is a theory created by me treating this lack of energy in the chakras using high diluted medication, because I am a medical doctor from Brazil, and in Brazil we don't have Chinese herbs to treat this lack of energy that usually use it in China, and that's why I began to study homeopathy. And during my course, I created this new theory in homeopathy, linking homeopathy with traditional Chinese medicine. And using this kind of medication, I can treat this lack of energy, these imbalances, and the patient can have normal functioning of the whole body too. And after 2 or 3 months of treatment, using these reasoning, all these tools I mentioned. After 3 months with the surgery schedule, it was request for the patient to repeat the exams. And I suggested the patient to reschedule the surgery, but she did the surgery. And during the surgery, she did a freezing biopsy during the surgery. And as the result of the biopsy, it was discovered that the tumor had turned benign, it was not malignant anymore. And after this discovery, the patient did not need to do any more chemotherapy or iodotherapy, and she did not need to take out her thyroid anymore. And now the thyroid is normally functioning, not needing to be taken out surgically with the treatment she did in my clinic. Now I will describe the second case report. Is a 38-year-old female patient that came to my clinic after having an exam showing a typical cellular result in a pap smear exam. The patient was frightened by the idea of cancer, and in Chinese medicine, her diagnosis was yin and qi blood deficiency and heat retention. Her treatment consisted with Chinese dietary counseling, as in the first case report, auricular acupuncture and systemic acupuncture with apex ear bloodletting, and her chakras energy were in the lowest level too, like in the case 1. And she did the treatment of acupuncture and replenished the chakras energy with the high diluted medication, as I showed you in the first presentation. And the result of this case was that she improved it after 1 month of treatment, and she returned to the gynecologist and did the exam again. And the exam showed that she doesn't have any more any atypical cells, and it was normally and only doing this kind of treatment. Now I will show you the third case report. It's the last case. I will talk about one patient of 42 years old, man, undergoing treatment of lung cancer and being medicated with chemotherapy. Even in the treatment, the patient had the metastases in the brain and other parts of the body, being even able to touch externally a metastatic tumor on his abdominal wall and several cervical ganglions. A neurosurgery was performed to remove the brain tumors, and his oncologist continued with the chemotherapy process, which was not reducing the It was reducing the metastatic tumors, but what we saw in his case, what he was reducing, but it was appearing that was appearing new metastases in other parts of his body. And since the first consultation, he did the radiesthesia procedure that showed that all his internal organs were in the lowest level of energy, with the exception only the 7 chakras. And he did the same treatment using Chinese dietary counseling, avoiding dairy products, raw food, cold water, drinks, alcoholic beverages, and the coffee and sodas and all the fried foods, egg, coconut, alcoholic beverages, chocolate was also avoided too. And he did auricular acupuncture, systemic acupuncture, moxibustion, and the use of high diluted medication to improve his chakras energy. And after undergoing TCM's prescribed treatment, the patient had an incredible improvement in his dyspnea, and there was a disappearance of all metastases and also the lung tumor itself. With the improvement in his health, the patient also had an overall improvement both physically and psychologically, even though he was still undergoing certain chemotherapy treatments. After 2 years of TCM treatment, the patient was happy to be healthy enough to have his girlfriend pregnant. And the diagnosis and treatment of Western medicine is focused on the leaf level, as I show you, and therefore the treatment is focused on the patient's tumor. In TCM, various symptoms of different specialties can be treated at the same time, as observed in the glaucoma patient I mentioned in the beginning of this presentation. And the energy imbalances on the metaphor of the tree, on the root of the tree, is represented by yin-yang theory and the 5-element theory. And to be healthy, we aim to state an equilibrium between yin and yang energies. And if there are imbalances between these two energies, symptoms occur, and if not properly treated, it consolidates the disease in the future, in this case, cancer. Yin and yang are energy forces that rule the world, and everything in the universe is composed of yin and yang, including our human bodies. And the symmetrical arrangement of the dark yin and the light yang is not static, as we can see in this symbol. It is a rotational symmetry and suggests a continuous cyclical movement. This is the chart that I showed you in the beginning. That is the necessity of balancing these 4 energies to improve health of our patient. And in this case, we can also treat cancer patients only doing this energy balance state. And here's to show you that when there is a deficiency of one or a combination of these 4 energies, when there are deficiencies, the body begins to produce the internal heat that is like a fire inside the body. And the cancer is formed by deficiency of the energy with the heat retention. This is a chart demonstrating what are the energy deficiencies in cancer patients. All patients have energy deficiencies because energy means immune system. And when the energy is low, the immune system is low. And the combination of lack of energy and the formation of heat is all the energy deficiencies leading to formation of cancer in TCM. Compared to Western medicine, Chinese medicine considers the root cause of tumorigenesis is a decline of immunity due to energy deficiency, which in all case studies presented today had in common the complete lack of energy in the chakra centers. Oh, sorry. I have some problems, sorry, let me see.
What happened?
No, I am finishing this presentation.
Okay.
Here is some questions that I usually do to see how is the energy of this patient. about the blood deficiency, iron deficiency, young deficiency, heat retention, chi deficiencies. And here is only to showing you that all the internal organs are interconnected by the energy flow. And when you treat these energy deficiencies in the internal organs energy, you need to do according to this sequence and to give the medications. And here's to show you that that they have in common the chakras energy deficiencies. And here is the chart demonstrating the progression of health to disease. The progression is divided in 5 phases. The first 3 phases, there are energy imbalances, but the exams, laboratory exams, are still normal. This is not when the patient has symptoms, but the exams are normal. This does not mean that the patient doesn't have anything. The patient have energy imbalances leading to that symptoms, but they don't alter the laboratory exams. Only in the phase 4, when the laboratory exams are altered, that the Western medicine do the diagnosis, and the diagnosis in the late, it's very delayed. That's why we need to treat the patients in the first 3 phases when there are energy imbalances, but the exam is still normal, because to alter the exam when the energy imbalances begin, it lasts about 5 to 10 years to have energy, to have laboratory alterations. Here in the phase 5, I'm demonstrating that the cancer patients is in this phase where in Western medicine they consider that the cancer is a irreversible cellular lesion, but in this presentation demonstrated in the patient case 1 that her thyroid was malignant and turned benign. She went for the phase 5 to the phase 4, and in the second case, she went from the phase 5 to phase 3 because the exams were still normal and what was not malignant anymore. So in addition to all the guidelines made by Western medicine, this work shows that cancer is not the last stage and that we can make the patient return by removing the internal heat through apex bloodletting, correcting the feeding through the Chinese dietary counseling, and keep everything in balance. In addition to restore the energy of the chakras through homeopathies according to the constitutional homeopathy of the 5 elements based on traditional Chinese medicine theory and crystal-based medications. Here's to showing you why I'm using high diluted medication instead of a high concentrated medication. This graph is showing the Arndt-Schultz law, formulated in 1888 by 2 Chilean researchers. And they state that the use of high concentrated medication can reduce even more the vital energy that is already low in this kind of patients. And using this kind of high concentrated medication, you can harm the vital energy, leading to a less immune system. And that's why the use of high diluted medication is important in these patients, improving the immune system. And with the improvement of the immune system, our immune system can fight against the formation of more malignant cells, and they will treat the patient only using our immune system without the need to do any more give any more therapy. And that here is so demonstrating you that to treat cancer, you need a holistic approach of this patient, looking at the mind, spirit, and the body, and to see the medicine as a whole, as not looking only by Western medicine point of view in the leaf level, but you need to know that the roots are usually impaired in these kind of patients, and we need to fortify the energy in the root to treat the cancer.